Hello, welcome to another episode of Startup Health Now, the weekly show celebrating the healthcare transformers and changemakers reimagining healthcare. My name is Stephen Krein, and on today's episode, we're going to sit down with Reed Mullins, the co-founder of Doctor.com, that is reimagining how doctors use the internet to grow their practice. This is going to be a great episode.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Welcome back to Startup Health Now. We're sitting down with Reed Mullins, the co-founder of Doctor.com. Welcome to the show, Reed.
Thanks. Good to be here.
It's great to have you here. And you know, it's been great to have spent the last several years, working with you, Gary, and Andre on building Doctor.com. But for the listeners, let's learn a little bit about Doctor.com and how it got started and really what drove you guys to focus on this area of healthcare.
Sure. So Doctor.com's goal is really to give healthcare providers the means to control their reputation and presence online. You know, when you go to medical school, it turns out you don't learn anything about internet marketing. So as internet marketers and technologists, we saw an opportunity to enter the healthcare space and use all of our experiences to help the healthcare provider deal with some of these challenges that they'd never really faced before. And it's a space that changes really fast. So you really need a dedicated team thinking about what the healthcare provider needs, in terms of representing their accurate data everywhere, in terms of dealing with reviews, which we kind of consider like the digital word of mouth that's kind of changing the space, and really give them control over some of these aspects that they really never learned much about.
So we're going to dig in a little bit more to that, but I want to kind of go back a little bit in how Doctor.com got started by you guys. Because besides the name, what brought you guys together and a little bit of what led to the development of it?
Well, Andre and I have been friends since childhood. He's been more of from the technology background, and I've been more in sort of the sales and business management side. And we got back together in our 20s to form Practice Brain. It's a kind of everything of an EMR for specifically physical therapy. And learning about the physical therapy space, we started by building out their website, handling their online appointment requests, and then started to deal with their data around the web, and we just kind of went down the chain from there, handling the way the actual clinical workflow started to operate. Mm-hmm. And from there, we just saw challenges everywhere. And in that same sort of space of time, we met Gary Millen, who's the owner of the domain and runs World Media Group, and we saw an opportunity to have this kind of 1 + 1 = 3 experience, to take the doctor directory from Doctor.com and some of the sort of deeper functionalities we developed at Practice Brain, and really come up with one unified solution for the healthcare provider.
So how much has the idea changed from the three of you coming together to start this to actually today?
It certainly has changed as we've realized that there are a lot of people who are fighting those clinical challenges, and there's not a lot of people successfully fighting the reputation management challenges. So we've focused more and more on those as our kind of specific differentiator.
Gotcha. So let's dig in a little bit Doctor.com. How does it work? How do you, whether you're a physician or a consumer, or per even maybe a hospital, how would they interact with Doctor.com?
Sure. So we're kind of interesting because we have a lot of stakeholders that come at us from a lot of different angles. So for the healthcare provider, what we end up doing with them is taking their accurate information and syndicating it all across the web, and taking the sort of.
Hold on, you said accurate information. Let's talk about dig in there a little bit.
So we'll back up another quick second. One of the things that we've started to realize is that doctors have a tendency to change their practices, change their phone number, go from one practice to another, decide to work at the hospital and then leave the hospital. Any healthcare provider listening to this knows that they have probably. They've had this experience, right? And so what that leaves behind is this dirty trail of data. There's hundreds of websites that are pulling from the NPI database, that are pulling from the business listings, and they have a tendency to do those as like one-time dumps. And so any healthcare provider will have 5, 6, 7 addresses as you look across the various websites.
So when you do a Google search there, it's and
Exactly.
and so you take their accurate data, once you've figured out which one's accurate.
Directly from them.
And directly from and then you're syndicating it out so that
Correct.
everybody else either replaces it or at least you call out who's got the accuracy.
Single point of entry.
Okay.
So we offer the healthcare provider one single place instead of spending like days or weeks claiming all these. We give them one single spot.
So
where they
what
can handle
sites
all
do you
that.
get syndicated out to?
So right now we are syndicating out to Vitals, Healthline, Your Doctor, Ask. If you're a chiropractor, chiropractor.com. If you're a dentist, dentalplans.com. We have inked deals with Wellness, DocSpot, U.S. News, and there's a few others that are going to get announced
So
very shortly.
pretty close to pretty large footprint here.
Oh, yeah.
Do you talk about the numbers of how many places?
Sure.
or how
On
much
any
visibility?
given month, there's between 50 and 70 million patients who go across aspects of our network that we control.
Okay, so that's related to their basic contact information and data. Let's go a little bit deeper. What else? Reviews. I know there's other aspects of
Yeah,
this.
so there are. It's not just that sort of NAP consistency, name, address, phone number stuff. There's also some of the optimization stuff. Really nicely written bios, photos, where you went to school, what insurances you accept currently.
Mm-hmm.
The insurances one is a killer, because people will find that they will change the insurances they accept pretty rapidly, and that is a really important search vector for patients. So we take that information, instead of making them do that in a million different places, they just work with their account manager, tell them once, and we handle all the rest. And so it's the photos, it's the rich content, those bios, and some of those aspects. The reviews also go out, candidly, to a more limited subset. There are certain players in this network for whom consumer reviews are still too new and too scary. Specifically, like a U.S. News is very clinical, and so they right now are not syndicating the consumer reviews data.
Gotcha.
But we're working towards that as the marketplace has started to realize that the consumer review is legitimate. That's an important vector.
And are you selling these services to doctors? Can they buy them, kind of a la carte, or is it kind of one package that you're offering them?
We have a few packages. There's some. So we found that doctors sort of fall into these two camps. They are either interested in reputation management and correcting their information, getting more reviews, getting those reviews out there, or they're more interested in the kind of the lead gen, getting more patients, bringing more people in the door directly. And so we have two packages at different prices for sort of each of those factors.
Okay, and so how do you differentiate? So if I'm a physician and I'm looking through the opportunity of kind of working with Doctor.com and having you not only syndicate my correct information but also power my listings, what are the options look like out there? How are you different than what they might look at, and whether it's Vitals or other companies even that partners with you, or they might look like competitors of yours? How do you differentiate yourself from everybody else?
It's a great question. We see ourselves as a do-it-for-you service. That is one of the core differentiators. You could conceivably go out to each member of the network, claim your profile, and maybe pay for a featured listing, or maybe get a chance to list some of your information there. But you'd have to deal with each one of those entities separately. Mm-hmm. You have to pay each one of those entities separately, and you have to do all the work. So we give you an opportunity to have this one single conversation, have this one single point of contact, and we deal with all those entities on your behalf.
All right. So working upstream here, when I want to go even a little bit deeper than that with you, what can I do as a physician, and what other kinds of services do you offer the physicians?
Sure. So the core part is this information syndication. We put a review hub in your office. So we have this device.
Yeah,
have a device.
Explain that one.
Physical device called the review hub. It's specific just to you, and it sits on your front desk. So as a patient finishes their appointment, they go out to the front desk to finish. Front desk manager says like, "Oh, how was your appointment with Dr. Krein today?" And you go, "Oh, it was great." And they go, "Oh, that's cool. So we would really appreciate if you wrote a review." So with this physical device in office, we're taking doctors who are getting 2 reviews a year, and they're getting on average 5 reviews a week.
Okay, so you're encouraging the doctors to get their reviews online, and so how's that business grown? And from about a year, when did you start that? About a year ago?
Yeah, about a year ago.
And so what does it look like today?
Exponential. Hundreds of devices out there, collecting thousands, tens of thousands of reviews. That is the fastest growing part of our business, because that's what patients want to see. You know, patients want to know when they're going to come see you that other patients have had good experiences there. There's some amazing statistics. The one that I saw most recently is that 7 out of 10 people who are given a referral are going to Google to read reviews about the doctor before they go. They're going to go Google your name, they're going to read all the reviews they can find, and that's before they go with a referral.
With the referral, right. So this is actually powering a lot of the marketing and visibility and reputation management of the physicians. Okay, so have a review of Doctor.com. 3 years from now, what does Doctor.com look like? And how do you think this evolves from today to kind of...
That's a great question. So
2018.
2018 is pretty far. So we see ourselves as the glue that holds together the many stakeholders who are existing in the healthcare space, from the doctors to the group practices to the hospitals to the insurance companies to the other doctor directories and to the tech companies. We want to be the sort of the single point of entry to collect the healthcare providers' information and make sure that everybody at least has those basics, who works where and what they do, and enable all those various stakeholders to be better. So we want to see ourselves as the way that the healthcare provider can control their presence in the ecosystem simply and easily. And so to that end, we're actually talking to CMS.
Center for Medicare Medicaid.
Yeah, Center for Medicare and Medicaid Services, who powers the NPI project. It was effectively the government-sponsored version of this project that started in 1999 because our data is better than theirs in many cases, and we're trying to figure out how we can help the federal government be better at what they do around this sort of core basic project. We want to be the sort of the glue that sits in the background and holds together these many silos.
All right, very cool. So I want to shift over to a little bit more entrepreneur kind of chat.
Yeah.
Because building this is not clearly a one-man show. You've got a great team. You guys have navigated through, a environment where, in real time here, we're watching the entire industry get disrupted. We're seeing people who used to not care about the internet and technology and all this stuff now have to care. Physicians, hospitals, other stakeholders. What are some of the challenges you guys have faced that you've either overcome or are still dealing with? Because I want to kind of draw a little color to, the other side. It's called the backstage of Doctor.com.
Oh. Yeah. So we came out of a few different entrepreneurial areas and in different industries. And one of the things that I kind of wasn't prepared for in the healthcare space is the level of regulation that sits on top of everything. It is like a very, I'm not a particularly buttoned up guy. It is like a very buttoned up kind of industry. And there are these just mammoth organizations that are slow to change. And slow to change for good reason. If you're making a photo sharing app and your servers go down, people don't get to share their pictures. If you have a clinical workflow application and it goes down, there are people whose lives are at risk. And so the industry understandably has a lot of caution around it. And figuring out the best ways to navigate some of these more cautious stakeholders has been a really interesting experience. My other friends who are in other startups like wear hoodies all the time. I just can't do that.
Little jealous.
Yeah, I'm a little jealous because it's not this has been a learning experience getting a chance to be inside this industry, which is like very staid and old school, and being a part of its sort of reinvigoration has been really exciting. And so those challenges have been very real. But at the end of the day, I think if you look backstage at Doctor, you'll see the same things you see backstage in almost any entrepreneurial venture. There's a lot of on my way over, I was thinking about entrepreneurialism, and so there are a few kind of like little cliches that came to mind as being really true. It's like you don't go to war with the army you want, you go to war with the army you have. Like Marines make do. These kind of things are really true. Where and so I'm not from the military. I have a lot of respect for the military. I'm not from there, but I am from the restaurant business. As a teenager in early 20s, I worked in a lot of kitchens and I cook all the time. And when you go home to make dinner, like you just have what you have in the kitchen and you have to figure it out. And so this is sort of the core of entrepreneurialism, is like, what can I produce with what I have around me? What's the best way to utilize what I've got? What's the best process to use? Yeah. And so we've combined all of the sort of the various teammates we've been able to kind of bring to the table and have learned from each of them and built a business with the sort of the army that we have. That's been the most fun part, I think.
So let's talk about your little, you, Gary, and Andre. How do you divide and conquer? What's your unique ability? What's Andre's? What's Gary's? And how do you make that mix? I think, I'm always proud of my partnership with Unity and have found that, it's actually very unique to be able to have, co-founders and partners that really sync well by focusing on their own unique abilities to contribute to the overall team. And obviously, as you build around those unique abilities and you expand out to the 5, 10, 15, 20, 30 people beyond the core, if it's good core, it reverberates really well. If it's bad, it doesn't. What do you guys, how do you guys mix and match there a little bit?
It's a good question. So I am very operationally minded. So it's my I guess special ability to look at both the technological and human process around trying to get something done. So we have a vision for how we want it, what we want to happen. We don't really know how it's going to work. Being able to get into the nitty gritty and just figure it out day to day and iterate and evolve that process. That's kind of the sort of the special skill set that I bring into the table. Gary was a Harvard MBA with 2 exits under his belt and has had tens of thousands of employees, has this like really big 100,000-foot view of where we are in the industry, how we interact with other businesses, and is the most skilled deal maker I've ever seen. His ability to bring compromise to the table between people that you wouldn't even think could be compromisable is truly remarkable. And then Andre is he's above all else is the smartest workhorse I've ever been near. If there's a problem that needs to be tackled, he's a fighter and he just gets it done, and brings lots of technological savvy and technological understanding to that. And so it's funny watching him go to sort of from being a core technologist to learning to really be the CEO has been an interesting experience of watching somebody who always had a great set of skills and understanding of people, and going from being really a product guy to being the CEO means he always has the product at heart. Even when he's like cranking through the P&L, he's still thinking about the product. It's like the product implications of the P&L. It's the product implications of the human resources, and watching that sort of bent on him has been really fascinating. Oh,
fair. So taking that and turning it into what lessons you've learned, and for the listeners, you're an active member of the startup health community or healthcare transformer. Several times you've come with kind of lessons learned. We call it Tales from the Trenches, and you come with your list of lessons learned about a particular part of your business that I think has been incredibly helpful to a lot of the other healthcare transformers. And as you know, learning lessons, you're learning all the time. Mistakes probably, things that you quote unquote think you screw up are actually where the biggest lessons are. What are two or three of the biggest lessons you've learned over the last few years from an entrepreneur standpoint?
Sure. So the most important thing is that you need to have market validation. It is always the desire of every organization to build the thing they think is cool and to spend all of their time building amazing product. But it turns out that you really need to market validate first. So we are a very intense sales organization, because just talking to VCs or just talking to other technologists or just reading the news, you may think that something might be interesting for someone, and it might be a perfect fit. But if you can't convince customers that they're going to pay for it, then it's not worth it.
So what do you think was going to work and didn't?
That's a really good question. So I had always thought that appointment reminders, ways to reduce that no-show count, was going to be like the linchpin in the whole thing. But it turns out that it's a much harder project to sell. When you sit down, and we tried to sell just everything under the sun to healthcare providers, and it turns out the things they're really interested in is getting new patients in the door and their reputation online. And it turns out their reputation online is actually a more important facet, because it's more than just getting patients in the door. Reputation online is getting your return patients to come back to you. Reputation online is becoming a thought leader in the space. Reputation online is making the most out of the patients you've already got on that referral basis. And so as we've honed in more and more on what is saleable, it turns out that is the most important facet.
Yeah. So what else?
What other lessons learned? Yeah. So when you work with organizations who are vendors, so one of the things that I end up doing is I'm kind of the de facto COO, sort of my operational head from a co-founder status, is that when you're trying to pick vendors and work with them, their size in the marketplace is not respective to the skill set they're going to bring to the table. As we've had some terrible experiences with some really core technologies that we thought were tested in the market and worked well. Don't listen to the sales guys. Try to get a PM on the phone before you ever product manager.
Yeah.
Like if you're going to pick a new phone system, for example, do not just sign a 3-year contract. You have to get a chance to talk to the PMs who are going to be doing the integrations with you, because not only even if the sales guys know, they're not going to tell you where the warts are, but the product managers will, because they kind of have to, and really do your diligence before you commit to any kind of new technology, because those core technologies are going to be really important. Other lessons learned. Do it the hard way when it comes to your internal data management. Do not cut any corners around your technical debt early, because they will come back to bite you.
So give me an example of.
So for us, some of the technical debt came around physician data. So physician data is incredibly dirty, and there's lots of places you can get it online. You can get it from the NPI for free.
Yep.
But the data is not clean, and if you don't take the time or find a vendor or additional API to help you with it, you're going to end up with a situation where there's doctors that are dead that are in your system, doctors that retired 10 years ago that are in your system, multiple different ways. You'd be surprised
home phone numbers.
You'd be surprised how many different ways an office manager can type, 675 Madison Avenue, 3rd floor. There's like 20 million different iterations of that. And when you get dirty data, you'll have 20 million different data points that are really all the same place. And when you try to do really good, clean work on top of it, you're going to have some challenges. So figure out the best way to get clean data right from the jump.
Yeah. So taking all those lessons, you're going to continue to learn a lot more. What do you think the whole market, so the market's completely being reimagined by entrepreneurs all over the world. We know that healthcare transformers coming out of the woodwork around, rethinking how we can remove the friction, how we can improve outcomes, how we can lower cost. What are you most excited about the next decade and what's happening right now, and kind of what is your vision of the future of healthcare?
So for me personally, and thinking about sort of why healthcare is important, I think a lot of it is around quality transparency. There's a lot of talk about cost transparency, and I think that will probably end up coming first or in tandem. But I think quality transparency is really important and is going to be a little more challenging to get to. But there's a lot of amazing organizations that are really working towards it, and we see ourselves as being kind of part of this wave. We're not talking about clinical quality; we're talking about the patient experience side. But when you can decide which doctor you're going to go to, because there's these all claims databases that are being formed. There's a lot of state-oriented all claims databases that are cranking through claims data, looking for quality based on these standard methodologies, where they're saying, like, this guy does this many knee operations, his knee operations end in these kind of clinical outcomes. And then you combine that with the patient data. This doctor, worked with me through this part of the experience, and their office was great, and the people they referred me to were wonderful, and my physical therapist was great. And combining both the clinical claims side and the patient experience side, I think that we're going to end up with a situation where every stakeholder, the hospitals that are hiring doctors, the patients that are choosing doctors, the technology companies that are trying to come to some deeper understandings, are all going to have access to this one wide, non-siloed data set that contains both clinical and patient-side quality information.
Right. So you're talking about the democratization of data. I mean, this has 100%. Been available to the people who have connections and sit within a couple of phone calls of being able to find those doctors. But what you're talking about is making that available to everybody in the world.
Exactly. Because right now, I think one of the things that's happening is that there are great doctors who are having a hard time getting patients in the door. That's if we wake up every day with a mission, it's to identify and find those great doctors and make sure that the patients can find them, and that it isn't just this kind of like old boys network of a handful of providers in their hometown who just refer everybody to each other. And we can give the new doctors, the better doctors, the doctors who aren't great marketers, the opportunity to engage with those patients.
Fantastic. All right, so we're going to lighten it up a little bit to finish up. What tools do you use to manage your day, manage your company.
Oh,
So
interesting.
what's on your iPhone? What's on your desktop?
So I'm a hardcore Google head.
Okay.
I find that you can, and it's nothing about Apple, but if you can commit to an ecosystem, you will find vast benefits. So an Android phone, we run our business on Google Apps. On my personal side, I use Google Voice. We're starting to work with Switchco as a phone provider. Google Calendar, Slack plugs really nicely into Google Apps. Like
loving Slack.
I love Slack. Slack is amazing. We're really proud of our dispersed team, and Slack has given us the communication backbone to really make sure that if you ever had a conversation with somebody, you can just go search it and find it later. It's amazing. I just upgraded to the new Surface Pro 3, which I'm a huge fan of. I don't carry around a piece of paper when I go and take notes in meetings anymore. It has the best pen. So I can take written notes instead of typing my notes in the middle of meetings, which always feels weird.
Right.
I don't like that feeling. So I write the notes on like a Surface
Pro 3 is the electronic pen.
So the Surface Pro 3 is
Surface
the
Pro
laptop.
3. Oh,
Yeah,
but you're full on like non-Apple stuff.
Yeah, it's not, and again, it's not a judgment on them particularly. It's more just about ecosystem.
Sure.
If you can commit to an ecosystem, there's just vast benefits that kind of come out of it.
Even though that's Microsoft, right? Is that
even it is? It is a Microsoft product, and because I'm wearing Windows,
right?
So I'm like I'm a Windows.
All right. So you got your Slack, you got your Google Apps, you got your Surface Pro 3. What are you using to manage all your projects? How are you guys communicating your tasks and priorities and things like that?
So we have Fabricator for the sort of development team, and then I'm a Google Keep guy for my like personal what my to-do lists are. Yeah.
Very cool. All right.
Really
Well, this has been great. I always appreciate spending time with you. I always love your lessons learned. Your Tales from the Trenches is always a highly rated part of our summits every time we have you on there. So thanks for being an active part of the startup health community, being a kick-ass healthcare transformer. And Andre, you and Gary are just doing fantastic work. So excited to both watch and help you guys grow Doctor.com, and in the years ahead, we know you're going to help transform healthcare. So
it's been my pleasure. Thanks a lot for having me.
Well, thanks for joining us on today's episode of Startup Health Now. You can find today's episode and all episodes of Startup Health Now on startuphealth.com/now. Have a great day.